During the first and the third trimester of pregnancy, dental treatment is usually avoided. But what if you suddenly get a patient with a severe unbearable pain? She is not able to sit or stand and she is either in her first or third trimester. She already popped in paracetamol, that is, she is already on painkillers. So, in this situation, how will you give her any kind of treatment? And if she is not getting relief by paracetamol, will you use other higher level painkillers which may not be safe for her? So in today's video, we will discuss about the precautions to be taken for pregnant women during dental treatment and what kind of treatments and drugs are safe during pregnancy. The US FDA has classified all the drugs used as analgesic or painkillers into category A, B, C, D and X. Category A drugs are all completely safe during pregnancy, like folic acid, which you can give to the patient without a second thought. Category B drugs are those which are safe during pregnancy and in which no side effect has been observed during clinical trials. Animal studies do not show any risk to fetus and no adequate studies in actual pregnant women has ever been done. Drugs like paracetamol, acetaminophen, which are painkillers, are included in this category. Category C drugs are those drugs which can possibly harm the patient, but their benefits are more than their side effects. In some conditions, you can use it by weighing the pros and cons of the drug. Let me give you an example. Suppose you are performing a root canal treatment on a patient. You gave her lidocaine, which is a category B drug, but the patient has a hot tooth condition and the pulp could not be anesthetized properly. In such situation, you may have to use articaine. Since you have already given the lidocaine and you obviously cannot say, dear patient, you need to bear with the pain, which is clearly improper, especially in the case of pregnant patients. Cause if you continue to treat her under lidocaine and she is experiencing severe pain because of her hot tooth condition, her body will release cortisol, which is definitely not good for her. In such conditions, you need to inject her with articaine, which is a category C drug, which will help her more in that situation. Category D and Category X drugs must never be given and is totally contraindicated. We dentists usually do not prescribe these drugs ever. Most commonly prescribed drugs are usually Category B drugs, but you see, our discussion does not end here. The question which was posed in the beginning of the video still persists. So the answer is that you can do the emergency treatment at any time of the pregnancy, whether it is the first, second or the third trimester. You just cannot say that, dear patient, you have to bear with the pain because we are not allowed to treat during the first and the third trimesters. I am not talking about a root canal treatment or a restoration. This is about emergency conditions. Of course, this is cited in our books too. Emergency treatment can be offered in any trimester. So coming back, we have discussed about the category A, B and C. But you may still ask, you still haven't said which drugs to prescribe. Talking about painkillers, yes, paracetamol is the safest. And about antibiotics, plain amoxicillin, clindamycin and metronidazole can be given. While the plain amoxicillin is the most preferred drug, not with the clavulanic acid combination though, clindamycin and metronidazole do have some side effects which have been observed in the clinical studies. If you can avoid them, it is better. However, you should know that they are both category B drugs. Now, let's talk about the X-rays. Is taking X-rays even safe during pregnancy? So, I recently came across an article which cited that if you are not using Ledapron or thyroid collar, it is still safe during pregnancy with all our modern facilities. Now, this was actually shocking to me because before this, all the articles I had been through said that you have to use Ledapron and thyroid collar so that the radiation exposure on the patient decreases and the chances of any kind of genetic mutation to the baby possibly vanishes. But this article says that the radiation dose is so low that it does not pose any kind of harm. This article is pinned in the description in case you want to check. But if you ask my point of view, I'll certainly recommend the Ledapron and the thyroid collar even though it is deemed safe without it. Now let's talk about the procedures which are safe during pregnancy. So when a pregnant patient is seated on a dental chair, it must be the left lateral decubitus position. Her right hip must be elevated, the reason being the fetus applies pressure on the inferior vena cava during the third trimester. Staying in normal sitting position for much time can cause supine hypotensive syndrome. That is, the patient's blood pressure begins to drop because the fetus is compressing the vena cava. So, if you seat her on her left lateral position, the pressure on her vena cava is released and she feels more at ease. And when her treatment is over, it is advised that she avoids getting on her feet suddenly. Sometimes, suddenly standing up from the dental chair can cause a drop in her blood pressure and her vision becomes dark and she feels lightheaded and can even faint. So, these tips can help you manage with supine hypertensive syndrome and low BP, which is more common during the third trimester. Talking about the procedures, like I said in the beginning, emergency condition must always be prioritized. If the patient has a third molar impaction pain, you have to treat her properly. Leaving a patient in pain is not an option at all. And coming to simple restorations, they can be avoided and can be rescheduled to be done during the second trimester. The reason being, if you might start a restoration during the first trimester, usually it doesn't pose a problem at all. But by chance, if it is deep caries approaching the pulp cavity, then unnecessarily it might proceed to be a root canal treatment. The patient might feel chaotic. So instead, you can avoid whatever possible non-emergency treatments and postpone them to the second trimester. Speaking of the scaling procedures, they can be done during any trimesters, but during the third trimester, the patient might find it challenging to be able to sit in the dental chair for more than 15 to 20 minutes. So, even though scaling procedure is a completely permissible procedure during any trimester, it is advisable during the first or second trimesters only. So, I believe that we have covered all parts necessary for pregnant females. But still, if you have any more questions regarding that, do let me know in the comments. And now, we face another small question. What about lactating females? Which drugs are safe for the lactating females? Is it the same as the pregnancy drugs or is it something else? So for this, Lactmate is available. Lactmate is an online dictionary which has all the necessary info for all the medicines. I'll provide the link for it in the description. If you enter the name of the medicine you want to know about in detail, you can get all the results of the clinical studies on it and the condition in which that can be used. Talking about antibiotics, you can prescribe amoxicillin, clindamycin and metronidazole. But you must be aware that clindamycin and metronidazole show certain side effects like blood in stools and candida infection. So even in this case, amoxicillin is the king, cause it does not cause the side effects in lactating mothers. But this topic is extremely vast, so I'll provide the link in the description. Whatever medicines you use in your clinic, you can research in this dictionary. You'll get the clinical overview of it in there. For upgrading yourself every now and then is quite essential. So I hope that after watching this video, you'll be able to treat any pregnant woman at your clinic with a clear thought of what is safe and permissible for her. And while treating her, you won't have any kind of confusion. So this is Dr. Nihita. See you.